All right, so we are looking at the next method of contraception in women. We have kind of like trying to break down the whole concept, looking at it method by method. So for what we are looking at next is the Pomeroy sterilization technique. Okay, this one is for females, of course. So what we have for the Pomeroy, okay, it's pictures of it, but probably you might not actually appreciate till we now discuss it, okay, in literature, then compare it to what we are seeing in pictures. So Pomeroy technique, we said that is one of the most widely used techniques or methods for female sterilization, especially during what postpartum procedures. It's a form of tubal ligation, so it has to do with what you cutting off what the fallopian tubes, right? That's the tubal that we are talking about. So what is Pomeroy sterilization? So a loop of each fallopian tube is tied up with absorbable suture material. Then a small segment of the loop will be excised. Like, see, they tie it off, okay? Then they cut this part that is kind of like looped up. All right. So this will create a physical gap in the tube. So this will prevent eggs from being able to travel to the uterus, and also sperm from coming from the uterus down to the ovaries to reach. Okay, it's like you are taking off the bridge, okay, between the uterus and the ovaries. Okay, so absorbable sutures, the body will naturally absorb the suture over time, and the ends of the tube remain separated, okay, due to the scar. Okay, so later on now your body will absorb anything that was tied there, okay, but the gap between that will actually remain. So how is it performed? Setting is often done during a cesarean section or shortly after vaginal delivery. Okay, approach can be performed via what minilaparotomy or laparoscopy. Duration is quick. Okay, advantages is simple, is effective. Okay, that means what the failure, how can this actually fail? All right, this big gap, how could it fail? All right, it's almost impossible. So it's widely used, okay, and there's potential for reversibility. If I want to bring it back, I could actually cut and suture back the fallopian tubes. So that's it for the Pomeroy sterilization method or technique for females.